Now the next region that we're going to be working on is the neck. As a smaller region, we're going to be using smaller cups. Make sure you take the time in order to work as far up into the hairline as possible. Now this can be a little bit difficult as hair tends to make suction get lost. However, if we use just a little bit more oil or lubrication, we'll find that the cup will still stick even into that hairline. Let's take a look. So focusing in on the neck, this time we need to use slightly smaller cups. I'm going to use the two of the smaller cups that I have if I have the silicone set. And if I'm going to be using the pump set, in that case, again, I would use the two smallest sizes I have for the pump set. So let's try first with these silicone cups. Now, it can be quite difficult working on the neck and the upper trapezius because, of course, it's relatively small in size and there's a lot of shape and contour. So we're going to start with the small cup. Now, the smaller cup can be somewhat more difficult to apply because that little rim is harder to get your fingers around. So we'll try and do the same thing. Once we have the cup applied, I'm going to use this hand this time to pin the tissue and pull the cup up. So as I pin the tissue, it prevents other tissue from bunching up closer to the head. Now with that cup, I want to get as close as I possibly can to the scalp. Now what happens is once we come into the hairline and we get all these little hairs, the cup tends to pop off. So if I apply the cup again, I move up into that hairline as high as I can go. Now, if you're finding that the cup pops off a lot, which is exactly what it's going to do, we're going to apply a very, very small amount of oil right into that hairline. Now, with that excess little bit of oil, yeah, the cup will slide more, but we're also going to get more suction a little bit higher up. So applying the cup and pinning the tissue and pulling into that hairline. Let's try a slightly larger cup. Good, that's working much better. So right into the hairline, and then we're going to move it down, or we can leave it there so long as we're being very, very mindful of the color. When we have one cup there, we could put another cup on the opposite side, and we can continue to do the same techniques on the opposite side of the neck. Now, just as we did in the back, we can apply a pulling technique as well. We can put a cup on and pull. You'll find that it tends to pop off a little bit more. So with that being said, it's worth trying our plastic cups to see if they stick a little bit better and if they're going to be easier. So we'll apply the cup, we'll apply suction, and we can move. Now if we get into that hairline, we can just consistently pump in order to maintain suction. Once we get out of the hairline, the cup should stick quite nicely. We can leave the hose on. We can move around the neck. Now the direction, that's up to you. Play around with it and see what feels nice. I'm going to use a little bit of a bigger cup now for that upper trapezius. Now we can see a fair amount of tissue that's going into that cup. I'm going to move nice and slow and easy. As I mentioned before, we're always making sure to communicate with our client. Make sure that it's not too painful. You're doing okay? Now the tissue is getting nice and red, but we don't see that petechia yet. We don't see that little microvenual damage, so we can keep going a little bit more, noting that I'm not going towards the anterior side of the neck. Now we would do the exact same thing on the opposite side of the neck as well. So we can apply pressure, we can apply suction rather, and leave the cup there. Now with the pump set, what you do find is moving the cup to try and get the hose off. Oftentimes the cup does lose suction. Now after we've done a region, as we always do, we make sure we flush properly, particularly in the head and neck, because this can leave people with headaches if you work lots towards the head and we don't flush back. We have a little tiny bit of that petechia, exactly the color that we're looking for, nice and red. So this region is finished. Hey, thanks for watching. If you'd like to learn more about fascia, check out our free course called A Field Guide to Fascia, and you can find it in the description below. And it's a course where we go through all things fascia. That's what it is and why it matters, to functions and dysfunctions, to what you can do to keep your and your client's fascia healthy. So again, that's a free course and you can find it in the description below. All right, I'll see you next time.